you're welcome back. So the last class we stopped at damage to the lining of the small intestine. Now, before then we said malabsorption has many causes, but they fall into a few general categories. Now the first category is damage to the lining of the small intestine. We said under it, your small intestine is where most of the nutrient absorption happens. Of course, we said the small intestine also does the work of digestion, but apart from that, another work it does is absorption. Now, the mucous lining of the intestinal walls is involved in both secreting digestive enzymes, which helps in digestion, and absorbing liquefied food into the blood stream. So when one eats after digestion has taken place, the liquefied food will be absorbed by the small intestine into the bloodstream. But inflammation, which is also known as enteritis, and injury can damage this mucous membrane. Now, the damage can be temporary, which is acute, or long-lasting, which is chronic. Some causes of this damage to the lining of the small intestine include infectious diseases such as 1. Whipple's disease, Whipple, W-H-I-P-P-L-E-S, Whipple's disease, and tropical sprue. Now, inflammatory bowel disease also, such as ulcerative colitis and Crohn's disease. Autoimmune disease such as celiac disease also can cause that damage to the lining of the small intestine. Overuse of certain drugs and medication. Overuse, when no drug normally is not food, it's poison, except if it is going to be used for a particular purpose, and after that there should be discontinued use of it. But when there's an overuse of certain drugs and medication, it can cause damage to the lining of the small intestine. Alcohol use disorder also. The radiation therapy and chemotherapy. Now, short bowel syndrome, small intestinal bacterial overgrowth, overproduction of stomach acid. These are things that can cause damages to the lining of the small intestine. Now, 2, the second cause of malabsorption syndrome. We have the pancreas, gallbladder, and liver disease. Under it, the pancreas, liver, and gallbladder all work together with the small intestine to break down food. So you see, the small intestine, it doesn't do the breakdown of food alone. It's a collaborative work. So it does it in collaboration with the pancreas, the gallbladder, and the liver. Now, the pancreas makes important digestive enzymes, while the liver and gallbladder makes and store bile, which is important for digesting fat. So you see, this one is playing this role, that one is playing this role, just like in a home where you have father, mother, and children. The father has his role, the mother has his role, children have. So all of them are playing their role together to ensure what? Success. So that's how it also is for the small intestine. So the small intestine plays its own role. The pancreas secretes, it makes important digestive enzymes, while the liver and the gallbladder does what? They make and store what? Bile, which is also important for digesting fat. Now, these organs deliver their substances to small intestine when food is present, when you eat. Okay. So, but if a disease stops them from doing their job, the small intestine won't be able to break down food enough to absorb it, e.g. in pancreatic insufficiency, cystic fibrosis, bile duct blockages, gallbladder disease, liver disease. So in all these conditions, small intestine will not be able to do its work effectively. Now, number 3 cause of malabsorption, lymphatic system disease. The small intestine absorbs fat into the bloodstream through lymph vessels. It absorbs fat into the bloodstream through lymph vessels. So you see, the lymphatic system has its own work to play in order for both digestion and absorption of food to be effective. Diseases of the lymphatic system, blocking these vessels can compromise the absorption of fats. You know, we have different categories of food. You have the carbohydrates, you have the protein, you have the fats, and oil. So when there's a problem concerning the lymphatic system, then definitely absorption of fat will become a major problem. So the diseases of the lymphatic system, such as disease of the lymphatic system, blocking these vessels can compromise the absorption of fat. Intestinal lymphangiectasia and lymphoma are 2 examples of this. Then the next cause of malabsorption is food intolerances. Some persons have they have intolerance in some certain food. Now, under it, malabsorption of certain carbohydrates and proteins can occur as a side effect of gastrointestinal diseases. Listen, for example, fructose malabsorption, which is a common one. Sometimes people are born also lacking the necessary enzymes to break down certain nutrients. Lactose intolerance is the most common example. So some persons are born with lactose intolerance. So in such cases, there will definitely be problem when it comes to absorption. We will be looking at the laboratory diagnosis of malabsorption. Now let's go. There is no single test that can identify malabsorption or the underlying cause. No single test that, okay, for example, this is the test you use in identifying so and so thing. No. There's no single test for identifying the malabsorption. We'll have a group of tests that will give us a clue or an idea if there is problem with absorption. So number one of such tests is the breath test. Under it, the hydrogen breath test can help diagnose specific carbohydrate intolerances such as lactose intolerance as well as general small intestinal bacterial growth. Stool test. This can measure the fat content in stools. Stool has its own bulkiness and consistency, so there's something called stool test. So at the end of the day, it will measure the fat content in stools to diagnose fat malabsorption. It can also review parasitic infections, and it can show evidence of decreased pancreatic function. The third one here is the blood test. Now, we have some blood tests that can show us specific nutrient deficiencies that may result from malabsorption, as well as markers of specific conditions such as the celiac diseases. So these are some of the tests that can give us a clue or an idea whether there is a issue concerning malabsorption. So in our next topic, we'll kickstart with renal function of the kidney. Renal function of the kidney. So we'll be looking at that in our next class. So I still remain your loving lecturer, Mrs. Omogiani. See you in my next class. Bye.